Hello, everyone. Good afternoon. Thank you for coming to our panel. There are seats behind us still. I am very happy to welcome you today to this panel that we have called Transparency by Design, Facilitating the Fight Against Corruption with Behavioral Science. So we will speak about how behavioral science can be used in the anti-corruption and integrity efforts. We have a great group of panelists that have worked on these topics from very different sectors and in very different countries. And we hope to give you an overview basically of why focusing on behaviors and why trying to understand the behavior of people and the motivations that people have for doing certain things is interesting in anti-corruption efforts, not only to understand better why people are engaging in these behaviors that we want to change, but also on actually producing interventions that can change them. So I am very happy to introduce Claudia first. You are the head of prevention, research and innovation at the Basel Institute on Governance. Claudia combines academic research and technical assistant for promoting anti-corruption approaches. She will speak a little bit more about that in a moment. We have Sergejus as well, who is the former CEO of Transparency International Lithuania, founder of the Transparency International School on Integrity, lecturer at the ISM University here in Lithuania, and he served 2 terms as in the board of Transparency International. We have Frederick, who's a PhD in economics, has more than 20 years of experience working and researching on corruption. He was a professor of economics in Colombia. And from 2015, he leads the country work on public integrity in Latin America at the OECD and the MENA region, and leads also the work on applying behavioral insights for integrity policies in the same institution. And finally, we have Sadi, who's a professor, is a chair of social psychology at the London School of Economics. He's the director of the Paris Institute for Advanced Study. He has been the director of several groups, labs, institutions, including the Consumer Research Department at Credoc in France, the Social Forecast Unit at Électricité de France, EDF, the Laboratory of Design for Cognition at EDF, the Department of Social Psychology at the London School of Economics, and he was at the steering committee of the French Prime Minister's Forecast and Planning Unit. He will talk also about his research on representation, context, and behavior, digitalization of work, impact of context and rules on behavior, and hopefully on his upcoming book that will appear in October, and Polity Press on why people do what they do. And finally, I am Paulius. I will be moderating the session. I am the scientific director at the Paris Institute for Advanced Study. I'm a visiting fellow at the London School of Economics. I have been working on behavioral topics for over 10 years, first in the Colombian government in one of the first behavioral teams they created 10 years ago, then at the Center for Social Norms and Behavioral Dynamics at the University of Pennsylvania, where I was coordinating the activities, and now more with international organizations like the World Bank and USAID. So with that, I'm happy to start a little bit the panel. The first question or invitation that I had is for panelists to tell us in a couple of minutes a story of why the behavioral approach is useful for anti-corruption and integrity efforts. A little bit what you learned from it and what it could do in other cases. So I think we can start with Sergejus, speaking a little bit about the experience here in Lithuania.
Yes, so thank you so much, Paulo, for this kind introduction. I'm indeed Sergejus. I'm indeed from Lithuania, and I do think that it is a great opportunity to kick off this particular discussion with a story from Lithuania, because, well, you have enumerated many of my collaborations and relations to TI. I'm also very much interested in behavioral change. And this is what I've been focusing for a number of years here in Vilnius with colleagues from different organizations. And we focus quite a lot on something which matters to every single one of us in the anti-corruption domain, and that is bribery in healthcare. And this is precisely the story that I would like to share with you. A couple of years back, we carried out an initiative in an outpatient clinic, actually not very far away from here, the purpose of which was to lower the levels of bribery in that particular institution, and of course to change the way people understood the corruptibility of that outpatient clinic. I must say that we have gotten mixed results from that particular initiative, but they are quite promising. So just to tease you a little bit, I will say that if we compare the patient's view of the services and of the outpatient clinic before and after the initiative, we saw that our initiative contributed to their more positive perception of the medical personnel. Because of our initiative, patients thought that doctors became nicer to them. So 80% before, 88% after, a significant change. Those patients that participated in our initiative also were much more keen to suggest, to recommend the outpatient clinic to their friends, family members. We also learned that indeed, when you do an initiative of this kind, it changes the way people think they should behave in this particular environment. And what we did was actually very simple. We simply offered a feedback loop. We suggested that our patients, the patients of that Lazdynė outpatient clinic, would be able to evaluate the service they received on the way out. We had volunteers who would actively reach out, would suggest that they take into their hand 5 yellow balls and participate in the exercise we call the vitamin lab, and would distribute those 5 yellow balls accordingly in any random way they would like into one of the pillars that were there at the entrance of the outpatient clinic, basically either simply thanking the medical personnel, saying that they enjoyed the service, perhaps saying that there was something that they did not like, and so on. And what we saw, that those people who partook in that exercise actually, within the span of 2 months, changed their perception of how corrupt the outpatient clinic was in comparison to those who did not. The numbers were quite significant. So if, for instance, those who did not participate in the outpatient clinic, 1 out of 10 thought that, actually it's the other way around. So those who did not participate in the outpatient clinic exercise, 1 out of 5 thought that the gifts would make a lot of difference and gifts would help. Only 1 out of 10 thought so when they participated in this feedback loop exercise. The same went not just for gifts, but also for money. People who participated in the feedback loop were much less willing to think that money is needed. 1/3 of the patients who did not see or participate in the vitamin lab thought money would help. Only 1 out of 5 thought money would help when they participated in this vitamin lab. And of course, that was something very interesting to work with. We saw there was this change. However, we also saw that it was not that simple, because while people thought that the outpatient clinic, in a way, is a little less corrupt and a bit more transparent, they were not prepared to change their behavior as easily. So while they thought that would not be helpful, they would be willing to give that gift and that piece of money regardless. Yet, and I will leave us for this introduction on a positive note, what we also saw that there was this very clear message that bribery is a sign of poor quality service. Why? Because there was this intense interaction with doctors and patients when we were designing the whole intervention, yet a very clear outcome in terms of what we saw. And we saw that those people who thought that gifts and money is not needed were much more likely to recommend the outpatient clinic and services in the outpatient clinic to their friends and family than those who thought that money and gifts were needed. We use the Net Promoter Score. I'm sure you're aware of that. You know how it works. So basically the idea is that you score your experience from a 0 to a 10. 9 and 10 means that you are a fan of that particular procedure. The difference in the score was 50 points. So that was something which I hope could resonate with some of you. I'm happy to go into the nitty-gritty and the details of how we went about it later on. But for now, so much from me.
Wonderful, thank you. Yes, and we will have spaces for discussion and questions at the end. So if you want more details, you can ask. That's very interesting, and for me it shows a little bit what the behavioral approach tries to do across sectors, I would say. It's about identifying behaviors that are problematic for a specific challenge. In this case, we have bribery in the health sector. It's about understanding why people behave in that way from their perspective. What are their motivations? What are they trying to achieve? It's about creating what we call interventions, and that can be anything from campaigns to anything, to try to change those beliefs and those conditions that make people behave in the way they do. And finally, it's about trying to see what change in terms of the beliefs people have, and hopefully in what they do in the everyday life. And it's in that way that we achieve impact for integrity and anti-corruption. I would like to go next with Claudia, who has been doing similar things in Africa. And I wonder first, yes, what you did and so on, and whether you saw differences or things that are similar to Lithuania in such a different context.
Yeah, thank you. Yeah, so my story or my case study is also about bribery in the health sector, and I promise we didn't coordinate. We actually did this, our respective projects before we met, but I think this underscores really how important, bribery in the health sector. This is something that really makes a dent with people. So in our case, we conducted a pilot project in Tanzania, in a Tanzanian health facility. This was funded by the GIA's program. And we wanted to tackle bribery from what we knew already was a big driver. And this has to do with social norms of reciprocity. So in Tanzania, gift giving is a very big thing. It's a very important part in the social fabric. So if you give a gift, you're supposed to reciprocate, and also it's very taboo to refuse a gift, right? You cannot do that socially without getting some kind of social consequence. And with the bribery, this is linked to the bribery in the sense that the behavior that we wanted to target is that users in health facilities often proactively offer a gift to the health worker with the idea that then they will get, quicker access to the treatment, better medicines, all sorts of privileges, but also giving a gift is a way to befriend the health worker so that it's not a one-off exchange, but it's about building a relationship that will go on into the future. So we wanted to target this behavior, and we did a very simple thing. We put up posters and then desk signs telling people, so bribery, gift giving, is no longer acceptable in this health facility. Please help health workers stay true to their professional ethics and do not offer a gift. So, the one element that I want to zoom into in this intervention is that I think that there's something that we can learn from the broader insights from behavioral science on how we can help people stay true to their professional ethics and act with integrity in the moment when they are under pressure. So from behavioral science, we know there's such a thing called the empathy gap. And what this means is that, say, if I'm in a training on how, my code of ethics or whatever, I'm sitting maybe in a conference room with my colleagues, we're learning all these precepts about what is the right and the wrong behavior. So it's all fine and clear in my head. But what happens when I am confronted with a user who is really pushy, who is and the users get really emotional, really angry if their gifts are not received. So when the health workers are confronted with this stress, it's difficult to stick by the behavior that they know, even though they know they should. They are under stress, they are pressured, so it's more likely that they will give in. So the question is, how do we intervene in that moment of time, in the right place, that we can give them a resource that can help them stick with the right behavior? So what we did, we had desk signs, and there was, of course, the user-facing desk sign, which was the anti-bribery message that I just explained to you. But on the health worker side, we put a very easy 4 steps that they could follow. So basically, what was facing the health worker said, if a patient offers you a gift, follow these 4 easy steps. Thank the patient for the appreciation of your work. Tell them you cannot accept the gift. Explain to them that you risk getting into trouble if you accept the gift. And if she or he insists, then tell them that she can donate something to charity to express their gratitude. So what we learned when we did the impact evaluation of our intervention is that actually having these visual references, both on the side of users and health workers, was useful to diffuse the tension of the moment. On the one hand, because some of the users were telling us, so now we understand that in this facility the social norm has changed. It is no longer acceptable to give a bribe. But also for the health workers, they told us, hey, look, when we have the pushy user who wants to give a bribe, we can diffuse the situation by pointing to the sign. So, look, it's not me. It's not that I don't want to receive your gift, but it's no longer possible here. So I'm going to leave it at that for now.
Wonderful. Thank you. That's very interesting, and I think we might come back to that in the end. But I hope you are starting to see a little bit how these things tend to play out in reality, and how it's about leveraging things like social norms, the beliefs we have about how other people are acting and what is considered acceptable or not, and also giving people something to do at the moment that the problematic situation is happening, so that they can go that route instead of the one that is prevalent and that we want to change. I want to go next with Frederick, who has done this kind of work on many countries around the world, and who has also worked on something that is very interesting and that is a little bit another step, which is not only like actual corruption behaviors or bribery, but also the risk, how to manage the risk before the things happen. Yes.
Yes, thank you, Paulius. Yes, both experiences before were trying to address some undesired behavior, bribery or how to react to it. I mean, this is fascinating, and there's a lot of insights from experimental ethics, for instance, that can be very, very relevant. But what I want to focus now is a bit the next step, as you say. So we are implementing policies, measures, methodologies aimed at reducing risks of corruption or corruption. And what we typically see is that often we do not get the results that we would have expected to get, what we call sometimes the implementation gap. We have a good idea, a good law, a good policy, and then we observe that actually either we observe nothing or not what we wanted to achieve. And I wanted to focus on corruption risk management because this is one of the, basically one of the, everybody agrees that this is key. It is very important to have corruption risk management. We all know that corruption cannot be eradicated. We need to mitigate the risks. But for this, you need to assess them first and identify them. And experience shows essentially that the methodologies around the world are quite similar. They are all based more or less, with some differences, but more or less all have this identification phase, then the assessment phase, likelihood, impact, and then the mitigation phase. And if we see why they fail to achieve the results, often when talking to public managers, for example, we see that there are aspects that are behavioral related, that they do not do the things that we would have expected them to do, or that they are not able to identify the risk or even understand what is a risk. So there's a lot of misunderstanding, for instance, between incidents of corruption and risks of corruption. So a public manager might be very little inclined to talk about risks if he thinks that it's like saying my unit is corrupt. So what we did in Brazil first, a bit on an exploratory way, and then in Romania and lately in Slovakia, is to really sit down with public manager and try to understand what are these barriers and enablers on corruption risk management. And just as a last, and we can talk about more details later, in the last report that has been published last week, in Slovak Republic, we did an experiment. In the interviews, we saw that there are, on the one hand, a big misunderstanding of what is a risk. And second, there's like a bit of fear in the administration of addressing, of talking about problems, including risk. So what we did is to have two vignette experiment online survey. One with a message trying to explain what is a risk in a very intuitive way. And another way, another vignette, a leadership message, so that the leader leads with good example and says, look, you can communicate risks, and the control group. And actually, it was clear that there was a significant increase, especially in both messages, but especially the leadership, for instance, was key. It was more than 15% increase in the likelihood of reporting risks. So it can, even small interventions can actually achieve quite significant change.
Wonderful. That's very interesting as well. And it takes me to another central topic that that we often discuss in behavioral science, and it's about this implementation gap. And the idea that policy interventions, the more traditional ones based on laws and norms and sometimes financial incentives, are necessary, they should be there, but a lot of the times they don't produce the desired effect in the actual behavior of people every day. Especially in complex context, in developing context, and so on. I am from Colombia, so I know this firsthand. Behavioral science tries to fill a little bit that gap, and it doesn't replace the norms or the policies. It's just trying to address that issue of why people are not complying, and try to put the desired outcome a little bit closer to the social relations and the social interactions that exist in the context. With that, I would like to go now to Sadi, who has been researching behavior, activity, transactions for a long time. So after hearing these 3 stories from the field, what do you think are the key points to pay attention to when we want to do this kind of work?
Well, thank you, Paulius and colleagues. I'm not familiar with this setup. I'm sorry we don't see you face to face, but so I think that what's very interesting in the 2 first stories is that the action was really at specific points of behavior. Okay, corruption is about what people do and that we don't want them to do, right? So behavior is what people do seen from the outside. Okay, but the reason people act is their activity. They want to do something, so they have a motive. When you see somebody acting, if you want to understand why, you need to understand the motives, right? There's a very interesting comment by Herbert Simon. He was looking at an ant walking on a beach, and he said it's very curious that the behavior on the ant at the point where it's walking is entirely determined by the shape of the context there, the little stones, etc. And that completely determines what it's doing. But the ant knows where it lives, and the final motive is the general direction, and it manages to get there. And what you must understand is that people act for a reason, and you can try to modify their behavior locally, but in the end, they will try to get there. You cannot stop somebody being hungry, because that's the motive, but you can feed them in a different way. And what we want to do is that they behave the way we think is legit, and that they do not behave in the way that is not legit. So the first thing when you see a corruption behavior is you have to try to figure out why people want to get there. Is that because they can't get the service otherwise? Or do they want to get something they do not have access to easily, etc.? Okay? So the first thing is to understand the motive, and then to act at the point of action, and that's exactly what you did. You provided the practitioners, at the moment they were confronted with the demands for petty corruption, the process to divert this behavior in another way that is legit, right? But you still enable them to satisfy the motive. In the case of Sergeius, the motive was to have a good relation with the doctor, to be sure, in the hope that they have a good, being well treated, or they wanted to express their thankfulness, and this is exactly what happened, but you don't want to express their thankfulness by giving money, but say a smile is okay, or donating to something else is okay, right? So you just divert locally, like for Simon's ant, what people will do locally so that it's legit. But to do this, you have to understand the whole trajectory, and this is exactly the kind of thing that you're doing, right? So it's trying to figure out at which point it is the best relevant to orient the trajectory so that the motive is satisfied, but in a way that is legit. And the way that is legit varies according to the context and to the cultures, etc. Now, there may be different motives, and some may be acceptable, some may not be acceptable, and this is a matter of what's the local culture, what's the local ethics. But remember that behavior, corruption is about behavior, but this behavior has a motive, and if you want to change what people do, you have to address why people do it, and then enable them to do it in a different way, because it is very likely that if you try to impeach them from doing what they want to do, they will find another way that you will not be able to predict. And this is why corruption always goes further and further, as long as you haven't solved the problem and found a decent way, an acceptable way to do this. Maybe I'll stop here. Yeah.
Wonderful, thank you. Yes, that's very interesting as well. And it takes me a little bit to a related area of literature in behavioral science that has been researched in many domains, from driving behavior to exercise to other things, which is the intention and action gap. So people have intentions to do things, they not always follow through to the actual behavior. And in these interventions, it's not really about changing the motive, the deep motive of what people want to do, but rather rechanneling the behavior to something that is not corrupt, and so on. Okay. I would like now to move on to a critical issue in behavioral science and in these things, both in practice and in research. And this hasn't really been solved in the literature or in the practice of behavioral science, and it's the sustainability of the interventions. Sustainability in terms of how long they last, because I'm sure you're wondering this already. These interventions where people get some materials or a sticker or something they see when they make the decision, will they really change the behavior of people so much that in 1 month, 6 months, 2 years, will we still see the change that we introduced? And this links to another critical issue, which is the link between individual change of people and broader system collective change, which is what we want to achieve. So broad change, and also change that lasts in time. I would invite the audience to share any stories they have of this or that speak to you with the topics we've been discussing. And in the meantime, while you prepare for that, I would probably ask Sadi first to comment a little bit on these issues.
Thanks, Paulius. So the problem here is not just about corruption. It's about how we want people to engage into behavior durably, like use less water or whatever. So, as a matter of fact, it's much easier than it seems, because whole society principle is about forcing people to behave as expected. Otherwise, there would be no cooperation, right? Like many of you never came in that room, but everybody found a seat. We all play our roles, and the reason we do this is because we've been channeled to do this, because we have a built environment that gives affordances. I mean, you can sit on chairs. Then we know what we're supposed to do. We're supposed to come here at a given time. So this is some kind of social pressure, and if we didn't do it, we would have been told that this is not the way it's done down here. And then we have embodied competences that we know how to sit, we know how to listen, we know how to speak, etc. Right? So if you want to channel people, we do that all the time. Think of how you take the plane. From the moment, I guess many of you took the plane or the train, from the moment you checked in to the moment that you got your luggage on the other side, you absolutely took no decision by yourself, maybe except tea or coffee in the plane or something like that. You sat exactly where you were supposed to sit and everything. You've been channeled all the way, right? And we have systems like this all the time. The way it works in the long term is that we have 3 layers. One is the built environment, which gives what Gibson calls affordances, that it was what you can technically do, right? If it's a corridor, you have to go there. You can't go through the walls, right? Affordances. The second is the embodied competences. That's how we've been trained and educated. So we know when we see a seat that we have to sit on it with our ass on it, not just standing on it, right? And the third one is social regulation, is that if you don't do things properly, somebody will come and tell you that this is not the way we do down here, okay? And so with these 3 layers, you are in a kind of triangle that leaves you a very, very small tunnel. And we all live in these tunnels of prediction. So if you want things to last for a long time, just telling people to do something doesn't work because they forget and they're not forced, and you know, it's easy not to do it. But if you have only the possibility to do this, and then if you're reminded that you have to do it like this and that you have learned how to do it by practice, then you will behave for a long time. Society is designed like this with installations that channel you along the way. So if you want to do something that takes people in the right tunnel, you have to design this. And administrations and processes and forms are exactly that kind of thing, right? You fall into a process that at every time you only have some possibilities and that you follow, right? And the more tight the process, the more it's going to be followed. Think about risky stuff, like when you stop your car for, you know, you have the warnings, you have a lot of things that force you to avoid an accident in a way. And you have to design your process in such a way that people are channeled all along the way, right? And there's very little capacity for divergence, right? And to do this, you have to look step by step at the process and see at every step where there's a possibility of divergence that is wrong, we would call it corruption or accident or something unsustainable, and then you try with one of the 3 layers, you know, built environment or education or regulation. Regulation is very important to sort of block that possibility or to divert the person to do the right thing. I know it's not very kind, right? But that's how societies operate, and it works very well.
Wonderful. That's very good. So that the idea of the channeling is very useful, I find, because it allows us to see that when confronted to these possibilities, people have a number of options. They have this channeling that prevents some options and allows others. And it shows also that we can intervene on that and try to redesign it a little bit. And some of the things we've been speaking about are great examples of that, like giving people something to do in the way we want, like in Claudia's example, and so on. Is there anyone from the audience that would like to share a very small story before giving you the, Frederick as well?
There's
the opportunity, have you faced similar challenges?
There's someone in the back there. Yeah.
Hello, everyone. My name is Stefan Evans. I am the Assistant Director at the Organization for Responsible Governance. We are an organization based in the Bahamas. So I love the dialogue around sort of giving people alternatives and showing them the different directions that they can go in. The challenge that we face, and it's similar to other small island developing states and developing nations, is a lot of times the factors that push people into undesirable behaviors that could be like small acts of corruption, like bribing or any sort of other social ill. What we find is that when we run educational programs around integrity, it isn't that people don't want to adjust their behavior, but it's that a lot of times the solution lies in better management, like at the government level or in the private sector. So for example, if a lot of people in the Bahamas, I'll throw us under the bus, but we tip like public service officers at the road traffic department to get our vehicles licensed, right? Mm-hmm. And that money is then supposed to be used to fix the roads. And when the roads aren't fixed, people get upset because they recognize that the public money isn't being properly managed. So there might be contracts that are given out to fix the roads, and there's not. We're still working on our public procurement laws and the reporting. So people aren't able to see where my investment in doing it the right way is actually going into creating a better landscape for integrity in the first place. So then you go on the roads and they're not fixed, and you end up having to fix your car very often, fix your tires, very, very small things. So for us as an organization that's promoting integrity among the citizens as well as working with government, it becomes a challenge in that we want to do better, but we can't because our government isn't doing what they're supposed to be doing, and so we don't have a pathway to do things better. And if we do it the right way, not only do we not see where our money is being used properly, but it takes, you have to take a whole day off from work just to get your driver's license renewed because the system itself is inefficient. So what we've been trying to do is we recognize if people can see that the government or other NGOs or private sector groups are working toward it, and if they're included in the process. So if the government explains, well, these are the challenges that we're having, and this is how we're working toward it, and this is the timeline that you can expect to see improvement, then people slowly begin to show more signs that well, I can change my behavior if I see where we're going. Yep. But there are so many instances where there's just no visible pathway in the foreseeable future that things are going to change, and so people, out of necessity, try to find their way around the system. And then when there are other challenges like low salary for public service officers, that only makes the whole situation worse. And so it's not that we have a completely bleak outlook on the situation, but we just recognize that sometimes diverting behaviors into things that are more positive, we're asking people to, in essence, inconvenience themselves and their families, and it shouldn't be that way. But that's sort of where we run into challenges in getting people to shift their behavior. So I don't know if anybody has sort of any advice outside of creating better linkages between government and citizens towards sustainable development, but that has been our approach at trying to mitigate against the challenge, and it is not easy, to say the least.
Yes, that's a great story element to discuss. Any insights? Yes.
If I can comment, I mean, what you're pointing at is the exact solution. If you analyze the whole system and see where it doesn't work, then you can at least point at it and make that the visible problem that should be addressed, right? When people bribe, or I mean, it's because it's too long to get the service, so there's some kind of dysfunction, right? So making this dysfunction explicit allows looking for a solution. Many times what is surprising is that most people are in good faith and it's just difficult. But the natural reaction of humans when they're frustrated is aggression and to accuse something and think people are incompetent or bad or whatever. So forcing by doing the analysis of looking where it doesn't work, then forces people to look for a solution. Then if you indeed involve most stakeholders, usually a solution can be found because it's just an arbitration of where you actually put the money or whatever the resources. But the transparency should be more about what is the nature of the problem than what is the behavior of people, if you see what I mean. So you're exactly in the right direction. And as you said, it probably works in the cases where you manage to show the whole process along the way.
Frederick?
Yes.
Yes.
And what you said also about the motivation, understanding what was the motivation of the delays. Was it by design? Did they delay to get bribes? Or was there some inefficiency in the procedures that can then be addressed by public management reforms, for instance? Otherwise, it's different. No? So understanding the motive that drives also the behaviors is also a very important step to take into account.
Great. Yes, we will do another one, and then at the end we will have more time to share other stories. Thank you.
Hello. Hello, I'm Jason Lee. I'm Taiwanese American, and I just want to add on to your experience based on my personal experiences on the social norm and how individual and a whole society can be better because of the social norms, but not in the limited and not in the regulating way, but in the self-sympathetic way, a compassionate way. Like, for example, my hometown is in Taiwan, and during last pandemic, Taiwan is the only country in the whole world that for 1 year, we resumed the common activity. We have concerts, we have movie theaters, we have everything going on. That's because, in my point of view, because my background is in biomedical engineering, but right now I'm based in Los Angeles doing impact investment and doing biotech investment. In my humble point of view, it's because, first of all, Taiwanese people has huge trust in Taiwanese government's handle of the healthcare system because, our healthcare system is pretty good. That's one point. But also because we can say Chinese culture or Taiwanese culture is very influenced by Chinese culture and Japanese culture due to historical reasons. People there, okay, they want to be compassionate in the way that they want to help others, but they also take care of themselves. But also, they think about how one's own behavior can affect others or help the common general. So in that sense, for example, the mask wearing in America, it becomes a huge problem. People say, oh, First Amendment, you're limiting my speech right, blah, blah, blah. But in Taiwan, the minute we know, okay, there's a new kind of virus, and there's people start wearing masks. People start distancing them from others. Because, okay, we also learned from SARS in early 2000. But fundamentally, people do it automatically, and government doesn't need to limit or set out regulations. And that provides us with a freer environment. So think about it. If everybody do right, then government don't have to make certain rules and restrict everybody. In that sense, because self-regulations and the culture and the compassionate in a good way. Okay, we're not talking about the bad ways that you have to fit in norms or you're outstanding and some people think that, you're bad. But in this way, like during the last pandemic, because our self-regulations, it create a common good and common environment for all. That's my experience. Thank you.
Thank you very much. Yes, that's very interesting. Any comments maybe from the panel? Yes, right. Yes, this is very good. Maybe let's continue then with this issue that we were discussing on promoting lasting change. I was wondering, Sergeius and Claudia, how did this work oh, there was Frederick before. Okay, sorry. Sergeius and Claudia, how did it work in your interventions? Did you manage to see long-term effects? If yes, in what sense, and what were the limitations? Yes.
Okay, so I'll go first, and it hasn't been really that long, so I cannot say about the long term. I think that, we finished the intervention early last year, so it's been about a year and a half. And as far as I know from my colleagues in Tanzania, the hospital staff are still quite upbeat and embracing of the idea. But what I want to stress here is that apart from putting up folders and the desk signs, we had another element in our intervention. And this was a peer-led element to our intervention, where we asked the hospital manager, who was our ally for our pilot, to pick a group of health workers who would act as champions. So these champions went out and disseminated this idea that it is actually bad for everybody if the health workers are receiving gifts from the users, and disseminate this across their social networks. So with their colleagues, with their friends within the hospital, and so on. And the idea for doing this is that, if there is a social norm that bribery is expected and accepted, then if we're asking people to change their behaviors, we're asking them to become social deviants, right? And this adds another layer of difficulty for people to want to change their behaviors and adhere to it. So we know that corruption is a highly networked phenomenon. So we are thinking anti-corruption can be a network phenomenon as well. So we need to build and support, enable the formation of networks of champions that then they can reinforce each other, and they were actually quite proud that their hospital, which was known to be a hotbed of bribery, was now being recognized that, hey, look, now Mwanamanyala Hospital has changed. So this also plays into, we have found in our research, in our work, that social status, reputation are powerful motivational factors for behavior, for driving behavior. So the idea, and we hope, we'll see with time, that if this becomes like a brand of the hospital, where the workers themselves are proud to uphold that reputation of the hospital, as now this is a clean hospital, that this can have enduring effect.
Wonderful. Sadi and then Sergeyus.
Yes, I just wanted to comment on that, and this links to what you said. There's something called the vigilante effect. Is that once you have learned what is the correct behavior here, right, you will not only in the future perform that correct behavior, but you are becoming a vigilante to others. So you will say, oh no, this is not the way we do down here, to other guys. So society is like that. We are, in a way, I'm not sure I should use that expression, but we are each other's policeman, right? Yeah. Or policewoman, right? And so if you manage to have people who know what to do, and especially if they're influencers like your champions, then this spreads. And at some point in the society, this becomes the way we do down here, exactly as in Taiwan, and this creates a huge social pressure. And human beings always try to be consistent with what others are doing and also what they have done before. And so if you manage to reach a certain threshold of people who have this kind of norm, then it spreads, right? So you should continue until you get that, and you should first start by using the built environment, because that's something that is very solid and stays the longest, right? And then at some point, people learn as they do. And once they have learned, they start teaching others. And they start teaching the kids, or the kids start teaching their parents, which happens through school. You can educate the adults because you educate the children, and the children educate the adults. But this vigilante effect is a wonderful effect of society that spreads norms, right?
That's a very powerful idea. I will comment on that as well in a moment, but before Sergeyus.
Yeah, so I'll adjust because there's so many of you, so I'll get up just to make it more democratic, because you guys are absolutely great. You bring up the issue of sustainability, and I think it's probably important and just fair to all of us to unpack a little bit the stories that Claudia and I shared, because there's a reason why I spewed the numbers at you, right? There's a lot of theory behind it, and now you know that there is, but there's a reason why we did certain things the way we did them, even though we did not know as much as we know now. And it goes to the core of the question of sustainability. And I also think that by unpacking that story, we will be able to pause and think whether what we do in our respective countries is the way to go forward if we speak about norm change and behavioral change. Because you will probably agree that in a lot of countries that you come from, anti-corruption first and foremost is on paper. Could you raise your hand if you have this feeling that it's on paper? You think it's happening in practice, yeah? Great. I'm happy for you. I think in our country, although we're like really high on CPI, a lot of things are on paper. And when it comes to the change in bribing practices, a lot of assumptions we make are wrong assumptions. And the stories from Tanzania and Lithuania are precisely about that. So, for instance, I would say that a zero bribery policy is a counterproductive policy, right? Because you could say, hey, from tomorrow you don't give bribes and you don't take bribes, but the stories that we're sharing is that, well, actually, it's very difficult to change that, because the reason why people give bribes is they want to feel safe and they want to procure the service in a quicker manner. A lot of anti-corruption policies would say, well, it's patience that we need to address. And why that happens? Because public policymakers think that that's the easier way to go about things, so they invest a lot in social media campaigns, and they don't want to touch doctors and medical professionals. Well, in reality, what our experience has been is that you have to address doctors and medical practitioners first, because they're the ones who message the way people are expected to behave. And then that is converted into, posters. What we did, creating this vitamin anti-corruption lab out of the outpatient clinic here in Lithuania. And that meant that, you have interactive workshops, you come up with values, you transmit those values from the first entrance to the outpatient clinic to the meeting with the doctor. Then you ask for the feedback loop, but it's the medical community that is in charge. And for me, that goes precisely to the point of sustainability, because a lot of times we think sustainability is about resources. Well, I would argue that sustainability is about the method that we actually use to create change. And if people feel the ownership of the method, and it's something which they feel comfortable with, and they're prepared to create a good example, then it can be much more sustainable because it will be incentivized and it will make sense for them to continue. But for that, and that is my last point at this moment, you have to agree that we're not going to be perfectionists when it comes to anti-corruption. We don't need to be perfect. We don't need to create policies which sound good, again on paper, but it's okay to create good examples. And those good examples can be just good enough and contextualized, because what we want them to work, and we want that particular community to actually adhere to those rules. And then you have to be conscious, because, for instance, you can't expect that doctors will say we're against bribes, but then if that same superintendent, the doctor that is in charge of the hospital, was taking bribes himself or herself, they will not be in a position to really moralize. Nobody will listen. So then it's an institutional change that is needed. Perhaps what then is also okay is that we agree that change doesn't happen all across the country, but happens in spurts. And you do good examples as opposed to some national legislation that obliges people to report on certain points. So that is, to me, sustainability, which of course goes hand in hand with resources allocated to anti-corruption work, risk management work. But as we saw in our intervention, it's not about anti-corruption, it's about the quality of services. So what you want to introduce very basic, small things first, and then build on that. And that is, to me, sustainability.
Wonderful. This is great. I think two ideas stood out to me in this. On the one hand, the thing about the systems and the physical, psychological, and social elements that intervene in the situation, and how that creates or can create endurable conditions in which people act, and not just one-off sensibilization campaigns or even trainings and so on. And the other one is about the vigilante effect, or mutual regulation, as it is called as well in other places. This in practice has been implemented very successfully in experiences like the one from Antanas Mokus, the former mayor of Bogota, who managed to decrease homicides by half, deaths in traffic accidents by half as well in 4 years. And one of the ways he did it is by giving people something to do when they saw someone behaving in the wrong way. So often when people behave in the wrong way, whatever we call that, there are others around that are seeing and that know that it's wrong, but that stay quiet because they are afraid of the consequences if they say something, or the other one reacting violently and so on. So what they did there was to give people a safe, slightly humorous way to react, to correct the other, and to communicate that this is not right, that this is not as acceptable as they think. And in that way, basically, you don't need to have a policeman in each corner of the city or in each doctor's cabinet, because people themselves will communicate and regulate that with each other. So in other topics than anti-corruption, but for example, for civic behaviors on the streets, for traffic behaviors and pedestrian behaviors, and where do you cross the street, the mayor's office distributed something like 50,000 cards which on one side had a thumbs up and on the other one they had a thumbs down. And citizens would carry those with them and carry them in their cars and show them to each other when they thought the other was doing something good or bad. And that was done in a slightly humorous manner, not aggressive, communicated as a way to help each other. And it produced broader changes in which people would regulate one another in a safe way, because there's always the danger that people don't take it as good, so you have to manage that. With that, yes, Frederick?
Yeah, I just wanted to give a slightly different perspective on your question of sustainability.
Yes.
Because in the first place, it's good to ask for this. I believe that many times in policy making, we don't even ask so much about sustainability. And I think that's the beauty about the behavioral approach. And I liked your thinking of channeling. And this is a bit invitation also for you to apply this. There are many methodologies around that can help you walk you through using a behavioral lens in whatever you are doing. So essentially, they are all more or less the same. I will just walk you briefly through what the OECD has developed. It's called the BASIC methodology, B-A-S-I-C, BASIC. So essentially, in the first place, you identify a behavior, an undesired behavior or a behavior that is problematic or something that you want to change. You analyze the behavior, the context, you try to really understand the motives, the drivers, the barriers, the biases that people may face, the social dimensions. So you try to get a full picture of what is behind this. So that's the A. Then based on this, you can think of strategies as strategies for change. So you are thinking, okay, if I want to change this behavior, what could I do? So then you will have many ideas of what you could do. And then you move, and this is perhaps something that we inherited from the research part. You do actually an intervention. You try out. It doesn't need to be like a randomized control trial always or something super sophisticated, but just pilot it, make an intervention, see, ask people, did it help? Was there a change? Before scaling this up. And then you can have the C, the change. Then you scale up, and then you can indeed change regulations, methodologies, and there comes the sustainability part, because there it is very important to monitor over time if there is really the change that you wanted to achieve. Sometimes you even get changes that you didn't want it, or over time it runs down, and or people turn back to old habits, but then you have to start again and think, okay, but what went wrong? So, and that's the beauty of the behavioral approach, and I invite you all to use it.
Great. Sadi?
Well, it's exactly what Frederick says. I just wanted to give you a practical advice is, first indeed, start with a pilot. Start small, it costs less, and then you can see all the unexpected effects and how to address these unexpected effects, which is very useful when you scale up, right? And the second thing is to do it with all the stakeholders. Invite the stakeholders. So my friend Volker Hartkopf has a very nice way of saying it. He says, you should never do things for the people, because what you do for the people, you do to the people. You should do things with the people, right? And in all my experience, the more you work with the stakeholders, the more you get good ideas, and most of the time they have better ideas than you have, because they know the goddamn thing, because they've been living in it, they're experts of their own behavior. So if you really want to know things, don't just do surveys, talk with people, and don't just talk with the people who are your initial targets, talk with the people who are involved in the process. And sometimes, it takes a while to see the adverse effects. Like you implement something, it looks like it's fine for a while, and then you realize that there's this thing that happens just once in a while, and then it has a, kind of cascading effect, and it comes back and bites you, right? And so unless you understand this before you do the scaling up, you face big problems. So start small, observe, discuss, listen, right? I always say that people who intervene, I mean, the change makers have one mouth and two ears, and they should listen twice as much as they talk, which is not, I have been doing, so I stopped.
Great. And Sergeius?
Yes, if I may, because I think this is key, right? And this is something which we've been, I'll get up again. This is key, and this is something which we've been discussing now. And again, I would like to pause and get that message across, that it's a major change in terms of how we think policy, anti-corruption policy. Because, again, bribery in Lithuania now is much less widespread than it was just 10, 15 years ago, and healthcare is an issue, but you see how difficult it is for people to go and talk to medical professionals, patients, because it's an uncomfortable conversation and they just leave it out there. Well, if you do interventions and you start with pilots, a lot of times it's very uncomfortable, but if you start small, it's much less uncomfortable than it would be if you do it, if you were to do it on the national stage, and you learn, and then you adjust. And I think the key point there is that you start doing those things, realizing that it's okay to fail, but failing is key to success. Yeah. And I think the anti-corruption community is very high on successes, and I'm, as guilty as charged, because a lot of times you try to say about all the wonderful things you do, well, in reality, you learn best from failures. But if you think of those failures in an orchestrated manner, you go pilot and you declare that it's okay to pivot and then fix and do some patchwork, then that could create a much greater contagious change. Just to give you an example, we did many other interventions on the behavioral side. I just thought healthcare would make most sense. But if we think healthcare, we also started with a very small initiative about 10 years ago with medical students. And the idea was that they wanted to do a conference, and we said, look, there's a small budget, let's go into hospitals and outpatient clinics and start something of a social nature there. And we came up with a sign, a motto, a slogan, which was their slogan, and it was, the best gift is your smile. And what they did, they simply proposed that they put those stickers on the doors of medical practitioners, and that was a huge issue because all of a sudden we realized that medical practitioners value their privacy and they really do not want you to touch their doors. But we went over, and in the span of 5 years, the number of hospitals and outpatient clinics that started to partake in that initiative increased 7-fold, from 10 in the first year to 70 in year 5. And essentially, those were the biggest hospitals. Got a lot of publicity, got a lot of traction in media and in the medical profession, and cost peanuts. Yet, I'm sure that contributed also very much to the cultural step change because doctors had to talk about it. Patients talked about it. We know stories when one day the stickers were up, the next day people would take them down. But these are the things I think that we're getting at, and they're much simpler than often look.
Great. This is very interesting. Before giving the audience the chance to ask questions and share stories again, I wanted to spend just 5 of the 20 minutes we have left speaking a little bit of another critical topic in these areas, which is resources, especially time and money. Often people think that these initiatives are expensive, that the behavior of people will take years and decades to change, so why work on that? And maybe more often, and this comes a little bit from my experience in the Colombian government and also in a few international agencies. The idea is a little bit why would I spend time and money on trying to understand why people behave in the way they do if I already know why they behave like that, because I've been working in these 10 years, because I have seen some things and so on. And why would I test different solutions if myself or my superiors already know what is the intervention we should do? So I wanted to get just a couple of comments from the panel of how this side of time and money works. Is it really that expensive? Does it really take all that time? How to justify to use resources on these things? Maybe Frederick, if you want to comment first.
I can start. This is something we hear a lot. This takes time, this is costly. But I believe, I mean, if you don't test and you implement something on scale and it doesn't work, it will be much more costly than the other way around. But then, the intervention we heard, these are not expensive. This is nothing much that takes a lot of money. And it's really worse. Even the analysis part is so, even if you don't get to the testing phase, for instance, having these discussions, what you said, talking to the different people, will provide you so much insights that's invaluable, and it's not so expensive. It's not, I think it's not a good argument.
Would Claudia and Sergeius
I can go first. You can go first.
Yes.
So I can give you numbers.
Yes.
The initiative that I first spoke about was about 30, and I'll get up again, 30,000 euros plus. But I think the key to your question is the second part of my answer, and that is that the price goes down as you do it more and more. And what I mean is that I don't think you need to repeat and replicate the same thing over and over again. And this is something, again, which is different from the way we now inform our national policies. Because, for instance, in Lithuania, just as in many other countries, I'm sure you have national representative surveys, self-reported surveys. So essentially what we do, we ask people what they think about corruption, whether they've given a bribe or not. Well, we also realize that they self-censor and they don't give you the exact numbers. And we seem to be happy with that because we're used to that for the past 20, 30 years. And those surveys cost a lot of money. The idea here would be that, look, you don't do those surveys that often because there's a lot of white noise and repetition, but you do interventions, you measure first time, the second time, and once you have worked out the method and you know that it can be done cheaper, well, then you do it with no measurement because it's fine. You know that things work already, or you can do it in a much more MVP manner. The other way around would be just what we did with stickers, just try what sticks. And if something sticks and there's a theory behind it, and you understand that there should be a causality that works, just try it out, and then you can build on it. So again, I think it's the way you approach the issue of resources, not how much it costs. And it's definitely much cheaper than a lot of national survey work that goes out there.
Wonderful. Sadi?
Yeah, I think it's, okay, someone who is a change maker is actually not usually using their own money, right? So either it's the money of your department, but usually there's not much. But if you do properly the analysis of the stakeholders, you will find on the way people who are interested in changing the situation. And these guys will actually be able to provide the resources that are necessary. I mean, I agree with Frederick that doing the first analysis is not costly at all. But then what you find, and this is the comment that you had, is suddenly you realize that there is a problem that creates the needs for bribery, etc. And solving this problem usually is not so costly technically, but it might be costly politically, right? So what you do is once you know the stakeholders and you know the problem and you make that problem explicit, and you may be using the press or other intermediaries, then the resources will have to be confronted. Those who have the resources and are interested will have to be confronted with the solution of the problem. So just looking at that thing in terms of monetary cost of one intervention from your department is not the right way of seeing things. You have to understand the problem, you have to set it up, and you have to bring in the people who are concerned with this and who might have the resources or might have the power to force the resources to solve the problem at the root, okay? So it's sometimes a bit of a long way if you want to solve the problem at the root, but if you don't solve it, people will find ways, and usually these ways will end up as corrupt behavior, right? Yeah. But so you have to think in a different manner of how to solve the problem. You're starting a political process and you have to involve the stakeholders in there, and the resources will come in due time. But you have to identify whose resources are necessary to solve the problem by finding all those who are concerned and have an interest in solving that problem. Some people don't have interest in solving that problem because they get bribes at the right moment, but a lot of people have concern about solving the problem, and they will help you in solving it.
Great.
Okay, so maybe to add from my side, I think that a very important element when thinking about sustainability is to think about putting the intended beneficiaries or users of our intervention in the driving seat. Because if there is uptake, if the whatever idea we come up with is actually helping them, and it's easy to adopt and it's something that they value, then I mean that it will be sustainable. And I think this links to what Sadi said at the beginning and was underscoring now again about the motivation. We need to understand the motivation. And the point that I want to bring here is that as much as I think adopting a behavioral lens is useful, it's not a silver bullet. I mean, there will be issues, very critical issues that cannot be solved with a behavioral approach. So in the case of our hospital, we had the issue about the salaries more or less solved because there was a champion in the management, and since this person took over, salaries were paid on time, properly, so that motivation had been taken away. Had it not been taken away, had we tried to run the intervention, say, in Uganda, where we know that salaries for health workers sometimes are not paid for months on, I mean, good luck with that. That's not going to work. So we need to think really where a behavioral approach is really going to add up. There's a really nice resource written by David Jackson and Neil Scobis that is about how to work with social norms in anti-corruption. And the thing they emphasize is that a social norm approach is useful when it helps relieve tensions from your intended beneficiaries. So in our case, you know, the salaries had been, you know, the situation had been improved. We also had a situation where the central government was becoming tougher on corruption, and public servants, including health workers, were actually scared of being caught. And they often even thought our researchers were undercover authorities from the anti-corruption agency. So they had a clear motivation for wanting to refuse the bribes from the users, but they needed this additional boost, and I think this is what our intervention brought to, on the one hand, help the users get this perception, okay, it's no longer a social norm in this hospital. I'm not expected to give a gift to get the treatment, but on the other hand, help the health workers relieve this tension and giving them tools to do so more easily.
Mm-hmm. Great. Thank you so much. Yes, in the 10 minutes that we have, I would like to invite questions and stories, and yes.
Greetings, everyone. My name is Evgen Tokar. I represent Ukraine, National Anti-Corruption Bureau of Ukraine. It's a very interesting topic for us. I like very much this idea that it's better not to create just obstacles on the way. It's better to change the goal. Yeah, but I think I understand how it works with petty corruption. But my agency is fighting against high-level corruption, and the goal of average high level official is to be rich, and not just rich, but very rich. We are talking about millions of dollars and so on. So the first step that I can see, it's like paying them good salaries. But if you are not Singapore, you can't afford really big salaries for state officials. So what can we do in other way? How can we correct this aim to be extremely rich for high-level officials? Thank you.
Mm-hmm. Very quickly, beyond a certain amount of money, being richer doesn't matter that much, but what matters is keeping your status in what you consider your circle, right? So one of the reasons these guys want more and more is that because their reference is that circle. So what you have to change there is the culture, right, of that specific circle, and make some kind of other value that they're interested in, the one that counts to be integrated. I know it's complicated, but this can be done with, you know, other currencies than money, right? So there, it would be a long discussion because it takes a while, but the way to go is this. The real motivations of these guys is not to get more, but to get a social position in some specific circles, right? For them or for their kids, right? We discussed that because that's a big issue. There's a big difference between petty corruption, which is getting access to what you have the right to get because the services don't work, or theft or extraction, you know, or greed. And so these things, but it's still humans and they still have motives, except that these motives usually are social. You want a big car not to go faster, but to have your standing in a specific circle where big cars count, right?
Mm-hmm. Mm-hmm. So, if I may, Yevgen, this is a wonderful question because we were just discussing it yesterday with colleagues. A very quick twofold answer. One, yes, you know, in my previous life, lots of TI, now much more expert work. So I talk to businesses a lot, right? I get invited to business clubs. And one of the conversations we have is, what is the difference between power and prestige? And I do think that in this region, a lot of people that are rich and wealthy and successful really base their success on power. While I think the goal that you have and the goal we have is to help them base their esteem, self-esteem on prestige. Now, power is taken as prestige is given. And I think that's something which is key again, because that is what then, if you're informed about it, can guide your narrative in terms of how to make them feel special. What are the ways to promote them as champions? This is what Claudia spoke about, this is what Sadi spoke about, but then it also goes the other way, preventive way. We were discussing risk management and conflicts of interest just yesterday in the evening. And in Lithuania, you know Lithuania by now is this anti-corruption theme park. We have a law on the conflicts of interest. We had a law a couple of years back, it was quite all right. We decided to change it, and we decided to change it because we thought we can delegate more responsibilities to people within institutions. And so instead of asking people to declare interests, we started asking them to declare conflicts of interest. And we failed miserably, because all of a sudden we introduced a certain level of subjectivity into declarations, and people said, well, hey, I actually don't have any conflicts of interest. I don't need to declare anything, right? So I think now it's a very interesting point to depart from, where you go, look, you can design your legislation sometimes in a more prescriptive manner, leaving less subjectivity, less space for subjectivity, more space for objectivity, and perhaps you should revert and, you know, ask them to do interests instead again, so on and so forth.
And no, and I completely agree. It's very complicated, especially when it's linked to organized crime and all this. But I believe as an anti-corruption community also, we are focusing a lot on these corrupt guys, you know, these bad guys. And I don't remember if you remember the Hydra from the Greek methodology. No? You cut one head and then there come more heads. It's okay. I mean, we need to detect, we need to sanction these cases. But what we perhaps have forgotten a bit, and this is where the experimental ethics and a lot of these lessons we have learned from the social norms comes in, we have to think of the wide majority of people who are not corrupt. And we have to find also ways, in addition to fighting this, to make them much more visible, much more strong, linking them, making them visible, because then it will also increasingly become difficult for these guys to do what they do. So it's both. But don't forget also the normal people who are there. And I think this is one of the strongest lessons from experimental ethics.
There was a question
Great.
around here.
Yes, we have 4 minutes now for another. Sorry. Yeah.
So can I take that?
Yes.
Okay, hi, my name is Angie Shlela. I'm a youth advocate from Lebanon. Lebanon really applies. I'm sure it's going to be a future case study in political psychology, specifically because when the October 17 revolution happened, suddenly everybody wanted to become a political psychologist just to answer the question of why did things get to where they were. Because we know what happened. We were living in the worst economic crisis in modern history. And obviously there's a lot of corruption, and even the word Ponzi scheme kept going around. So there were all of these indicators that things were going really bad in the government, yet people stayed silent. And so that was the main question. Why did people let it get to where they get? And so here there was this idea of like systems justifications theory that came into play, which is why do people who are in a disadvantaged system still not only justify it, but also defend it to whatever degree they can? And here I'd like to circle back to a lot of what was alluded to, which is behavior is much more of a symptom than it is something to directly tackle. And because in Lebanon, and I've had public officials say that to me directly, the official wage of a public official now, a public employee, is $200 a month around. They tell me I need to get a bribe to survive. In contexts like this, there is no such thing as approaching a topic immediately behaviorally. It is a symptom of the underlying political economy of where we're living. And so maybe if I'm going to have to find a question to turn around my rant, it's going to have to be how do we mainstream maybe a more behavioral approach just to make sure we don't have blind spots when it comes to cultural sensitivities, or to make sure that we're maybe producing more accurate academics and policies that might influence how we approach this in general. Thank you.
Thank you. We have 2 minutes. Does someone have a great answer for that?
I mean,
Yes.
again, you gave the response. The analysis shows that there is a problem because officials cannot live, right? And so this is something to put in the public space. Now, what do we do about this, right? If as long as the question is not posed openly, it will not be answered, right? It's not sure that it will be answered if it's posed openly, but at least it clarifies a bit the situation. Because again, as I said, when in times of stress, the first reaction of people is to accuse somebody else of the responsibility. And if you start accusing your own government, then this is the chaos, which is what you live. But then if you understand what is the situation of the government, maybe you have a bit more time to try to find some other solution, at least to search for it, instead of just accusing each other in various factions, as we do usually.
I wanted to add something real quick, because I think just revealing or revealing the hidden realities, can help change perceptions and can help change the debate. But also there are some, my Russian colleague Aliona Ledeneva, who has extensively researched the Soviet and Russian informal systems, she always talks about open secrets and knowing smiles. So these are the things that everybody knows, but nobody speaks openly. And sometimes bringing these things that everybody knows yet are not spoken into the public debate can be a start to change things.
You have to say the king is naked.
Yes.
and yes, and one additional element is in the Colombian government, I recognize a lot some of these things. In a period of crisis, we tried also to explore other forms of currency. Sometimes there's not more money to pay people, but there are other ways they really appreciate, other like recognition, like etc. And that goes.
Can you hear me? Oh.
Yes.
So, I think that we talked a little too much in Lebanon about what's wrong, to a degree that we see things as more wrong than actually, maybe we're a bit too pessimistic. So I don't think the issue is about, putting things out there. It's more so that, identifying the problem is not the same as finding the solution. There's a level of rudeness in the way that politics is conducted, which is that even though you know where what the situation is and what the problem is, people are totally fine with just... And I'm not blaming anybody. It's the unfortunate situation. We're in a vicious cycle.
Yes. Wonderful. We are 1 minute over time, so I think we will end here. Thank you so much, everyone, for coming. Thank you so much to the wonderful panelists. I think we will stay a little bit for a few moments if someone else has questions informally. And then, yes, thank you for coming.
Okay.